Let's talk about exercising after prolapse surgery. Now, this is a question I get asked all the time. What exercises are safe and when is it start? And my answer for you is a little bit more complicated, but let's get into it. But first, I want you to hit the subscribe button so you don't miss any of my new videos. So to understand when it's safe to go back to exercising after a prolapse surgery, we first have to understand how our pelvic floor works when we're exercising. Here is a picture of us standing sideways. Here's your bladder here. Here's your uterus, your vaginal canal, your rectum. So when you had your prolapse repair, they're basically taking your bladder here where it was falling and bulging down into the walls of your vagina, they're tacking it back up. So they're usually either adhering it on the inside to other or back up to where it's supposed to be with stitches, and sometimes they're using a graft of some sort to hold it back into place. Now, unfortunately, the fail rates of some of these surgeries are a little bit higher, basically meaning that how they repaired it comes undone and it comes back into falling down to where it was before. And so it's often very nerve-wracking for us to return to things like exercise because we don't want that to happen. Now, one of the most important things you can do in terms of returning to exercises after a prolapse repair is to make sure that, number one, your pelvic floor is strong enough. Number two, your pelvic floor is coordinated with the rest of your inner core. And number three, you know how to do that and use that with exercise. So, number one, everybody knows how to do a Kegel, or most people know how to do a Kegels, or at least have heard of Kegels. And that's fine, but that's not enough to return you back into doing exercise. Kegels is something that we do, right? We think we're contracting that pelvic floor. So we're contracting our pelvic floor muscle, that big bowl of muscles in the bottom there. We're contracting that muscle, right? So that muscle will squeeze and lift. And that's essentially what a Kegel is. We're usually sitting still in a chair, we're laying in our bed, and we're doing those Kegel exercises. Now, when we go back to exercise, we certainly aren't sitting still or laying down in our beds, right, when we're doing those things. And so we need to actually teach our pelvic floor how to move and work with us a little bit more. We also need our pelvic floor to actually work with the rest of our body. So a big part of movement of exercise is moving, adding load, adding force, lifting something, jumping. And so our pelvic floor needs to know how to move with us and how it's supposed to contract as your body is actually moving. Your pelvic floor is an anticipatory muscle, meaning that when we go to jump, when we go to lift something, when we go to push, pull, whatever it might be that we're doing, our pelvic floor is supposed to instinctively contract as well with our transverse abdominal, or our one of our lower abdominal muscles, muscles that you see down in that region here. They're supposed to contract together to stabilize our spine and our pelvis, and then to keep us continent. And that's what prevents any unwanted pressure going down into our pelvic floor, or pressure from our abdomen pushing down and wanting to push down onto that prolapse repair that you had done. Now, if you do something like a sit-up, if you do something like lift something heavy, I want you to first try this little test. Do you know how to contract your pelvic floor? Can you do that for me right now? Do a Kegel. Think about lifting a marble up into your vagina. Think about stopping your flow of pee when you're sitting on the toilet. Now, right, get a sense of what that feels like. That pelvic floor muscle is squeezing and lifting. Now, I want you to push down gently. Push down like you're trying to push out a toot, or push down like you're trying to push out a bowel movement. Right, what you'll feel when you're doing that push down, if you put your hand on your belly, you're going to feel a little bit of pressure going out into your hand. And if you think about your perineum area on the bottom here, you're going to feel pressure coming down into your perineum area, right? You're going to feel pressure coming down here when you do that bear down. Now, when you do something like a form of exercise where I'm adding load, your body is supposed to be doing a Kegel, not pushing down. And this is where number three comes in, where we need to know how that core coordination works in terms of exercise. When we do a sit-up, right? Our pelvic floor should be doing a Kegel. Our lower abdominal muscles should be pulling our belly button in like we're sucking into a tight pair of pants. When we're lifting a heavy weight, again, my pelvic floor should be lifting into that Kegel. My lower abdominal should be pulling inwards. And so if you know how to do that and your body is working properly for you, then great. You're making sure that your pelvic floor and your muscles are protecting against that prolapse repair. If your body does not want to do that automatically, then you have a little bit more work to do in terms of both strengthening and then coordinating your core with the rest of your body to make sure that it knows how to move with you. The first thing I would suggest doing is jump down to my free pelvic floor webinar for Prolapse. It's going to talk about what Prolapse is and what you should be doing about it. Now, how does that compare to you because you had a prolapse repair done? Well, the same reason that gave you the prolapse in the first place is the same things that are going to undo your prolapse. And so if you can resolve them, then your prolapse repair will be far more protected and you should have way less chances of having any issues with it coming undone or getting more pressure coming down so that bladder drops again. And so if you can learn how to get your body working properly and how to get your pelvic floor working properly, that is going to be the hugest key for you to having a successful prolapse surgery. So within my webinar, we talk about prolapse, what it is, what you need to be doing, and what you're missing with your exercises in terms of A, improving your prolapse, but B, for you in this case, it's going to be helpful in terms of making sure that repair stays safe. If you have any questions, don't forget to drop them in the comments below.